Assalamualaikum and salam sejahtera. I am Shafinas from Center for Nutrition Epidemiology Research Institute for Public Health. For today, I will be sharing findings from Malaysian Community Salt Survey entitled Sodium Intake and its Relationship with Anthropometric Measurements in Malaysian Adults. My course on 2017-2018. Okay, for the background, one of the growing worldwide public health concern is obesity. This is a state of excessive body fat accumulation. And among other risk factors, there is evidence reported that sodium intake is also associated with body weight and increased body mass index. Hence, this study aimed to explore the probable relationship between sodium intake by 24-hour urine excretion assessment and anthropometric measurements among Malaysian adults. The Malaysian Community Salt Survey, or MyCOS, was a cross-sectional study done nationwide from October 2017 to March 2018, and a total of 1,047 adults aged 18 years and above were included in this study. The survey was done through face-to-face interview, and it was carried out at respective respondents' homes. The socio-demographic information of respondents were collected, as well as the respondents' 24-hour urinary sample and anthropometric measurements. And body mass index was calculated and categorized based on the World Health Organization 1998 guidelines. The characteristics of respondents were presented as prevalence, including sex, age groups, marital status, education level, occupation, anthropometric measurements, and further analysis of a simple linear regression test was done as well to assess the relationship between 24-hour urinary excretion and changes in BMI, and as well as anthropometric measurements. And for statistical testing, p-values less than 0.05 were considered statistically significant. From the current findings, out of 1,047 respondents that were being interviewed, about 798 respondents had done the 24-hour urine collection. That brings to 76.0% of response rate. The prevalence by age group, almost half of the respondents is between the age of 40 years old and 59 years old, and the majority of the respondents was married. Next, the prevalence by BMI categories. Showed for underweight, it was 4.5%, and followed by normal weight with 35.2%, and overweight 37.5%, and for obese, it was 22.8%. Next, the prevalence for waist circumference, and for male respondents, those with waist circumference above 90 cm was 51.3%, and for female, the prevalence of waist circumference above 80 cm was 79.9%. Based on multivariate analysis, this finding showed us that age, sex, BMI, waist circumference, and marital status were significantly correlated with sodium intake measured by 24-hour urine excretion. From the current findings, it tells us that there was a significant positive relationship between urinary sodium excretion with weight and BMI of Malaysian adults. This emphasizes that excessive sodium intake may actually lead to obesity-related health problems. Therefore, further investigations or researches, and as well as salt intake reduction interventions, are necessary to highlight on the importance of sodium control and how it can potentially contribute to obesity prevention. And with that, I thank you for your time and attention. Have a good day.